Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Here we're going to look at the standardization of the rates of epidemiology. So, the standardization. So, when you look at the standardization of the rates, the first one is the direct standardization. The first will be the direct standardization. So, what is meant by the direct standardization? So, before that, when you talk about standardization, it is done to allow the comparison of the health status. So you compare the health status. So it is done to compare the health status of two population after the adjustment of the age, sex, etc. And you use using a standard population. So you use a standard population, not pollution, population. So the first one will be the direct standardization. First one is the direct. So as per the direct standardization, it uses the actual age specific death rates on the standard population. Actual age specific. So actual age specific death rates on a standard population. Next will be the concept is summarized. That is, first is the population of interest. Then you have the age specific mortality rate is known. Then you have the standardized population. So once the standardized population is done, then you compare the age adjusted mortality rates. Compare age adjusted mortality rates. So next is it is feasible only if actual specific rates of the subgroups of observed population are available. So only feasible. So when is it feasible? So it is feasible only if the actual specific rates of the subgroups of the observed population are available along with the number of people in each subgroup. So we need to know up to the number of people in each subgroups. Next is we move on to the indirect standardization. What is meant by indirect standardization? Indirect standardization, it uses a standard specific death rates. So there is a use of the standard age specific death rates. So age specific death rates are used on actual population. Then the concept is, first is you have the reference population, then you have a standard population. In between you have the age specific mortality rate, it will be known. Then you compare the standardized mortality ratios. You compare the standardized mortality ratios of the population of interest. Okay. Next will be to compare the adjusted mortality rate. So compare the adjacent mortality rate. So one form of this is known as a standardized mortality ratio. So it is SMR. So what is meant by standardized mortality ratio? It is a ratio of the total number of deaths that occur in the study group to the number of deaths that would have been expected to occur. So the number of deaths in the study group. So number of deaths in a study group, and then number of deaths in the study group to the number of deaths that would have been expected. So it is the number of deaths that is expected to occur in a study group that has experienced the death rates of standard population. So which have experienced the death rates of the standard population, death rate of standard population. Next is the other indirect methods. It includes the life table analysis. So other methods, what are they? They include the life table analysis, and then there's regression techniques as well as the multivariate analysis. To learn and grow daily like this, please do subscribe.